Right, welcome back to the program. It's Good Morning Nigeria, live on our network service of the NTA from Abuja. Now, as a prompt for the second part of our conversation on Nigeria's medicine security, I would like to take some excerpts from our earlier discussion. That's the first part, and it's put together by Ekene Ndelwe.
Medicine security, in a simple way for us, argues that except the people or a nation or a country exerts sufficient input on how the medicines they consume are produced, unless there is they exert sufficient input on how those medicines are produced, access to safe, access to quality, and affordable medicines will continue to be a mirage. It will continue to be rhetoric.
The national issue is that people still like to use imported products for whatever reason, even when there's a capacity. Secondly, the regulatory framework allows these things to happen, where most of our ports until recently were not manned by NAFDAC, and so things that shouldn't come in came in.
The national drug policy was established to be able to check and encourage the local production. Some of the objectives of the national drug policy was that it was estimated by 2010, Nigeria should be able to produce its own drugs locally.
In terms of funding, the Nigerian government has recently boosted funding to NIPRID. At the early part of the COVID pandemic, I personally engaged the Speaker of the National Assembly, Right Honorable Femi Gbajamiamila. And even without taking my mask off, he said, I recognize you, valid point, pharmaceutical sector will be prioritized, and they've backed it up. But guess what? Nigerians and Africans have a way of abdicating their responsibilities for government alone. Development of the pharma sector is not what government can do alone.
All right, now those were excerpts from the first part of our conversation on Nigeria's national medicine security. Today is part two, and we have guests with us who are in the studios, and then we also have guests who will be joining us from remote locations. First, let's welcome the Honorable Minister of Health, Dr. Osagie Ihandere. So, good morning, Nigeria, once again. Honorable Minister, delighted to have you this morning.
Thank you. Good morning.
Also here with us in the studios is Professor Martins Emeje. He is a member of the Pharmaceutical Society of Nigeria and immediate past national chairman, academic pharmacists in Nigeria. Good to have you with us, Professor Emeje. Delight this morning.
It's my pleasure to be here again. Good morning.
Okay, we have two guests joining us via Zoom. Let me first welcome Professor Mojisola Adeyeye. She's the Director General, National Agency for Food and Drug Administration and Control, NAFDAC. She joins us live via Zoom. Thank you very much, DG, for joining us.
Thank you very much. It's always good to be here. Thank you.
And also via Zoom, all the way from Owerri in Imo State, we are being joined by Professor Maurice Iwu. He is the President, Bioresources Development Group. Prof, thank you very much for joining us this morning.
Thank you. Good morning.
And just to indicate that Professor Maurice Iwu, of course, is a professor in one of the subfields of pharmacy, I believe. I'm not quite sure which exactly. But Prof, again, we are glad to have you. Let's begin with the Honorable Minister of Health, who is with us here in the Abuja studios. The imperative of national medicine security cannot be overemphasized. It's only been cast in much bolder relief with the coronavirus pandemic and the resort to vaccine nationalism, as we have seen amongst producer nations, and in some cases, such as in India, which is one of the sources of imports for us in terms of medicines, sometimes we've had announcements being made as to limitations on exports of their own produced medicines. So, Honorable Minister, tell us, what is your assessment in the first instance of our national medicine security, and what has been done to ramp this up?
Well, thank you. That is a very good question. What you must first look at is the starting point. Nigeria is coming from a period where we thought we could import everything. We had enough money, we didn't need to make anything, we didn't need to manufacture. We were importing everything, including food, and we didn't encourage the pharmaceutical industry either, because we thought we would just buy them and bring them in. Now the realization is clear, because first the resources to import everything are getting leaner and leaner, and the population is growing.
Okay, Honorable Minister, I'm sorry to interject. Our engineers are telling us that there is an issue with your microphone, which the engineers will come in to sort out in the meantime. So if the engineers are here, they could then just come in and then sort out the microphone of the Honorable Minister of Health. But let's still just seek to contextualize the conversation in terms of imperative of national medicine security. Professor Morris Iwu, of course, was, as I said, a professor of pharmacy and president of Bioresources Development Group, with us via Zoom from Owerri, the capital of Imo State. Prof, give us your insight into this critical subject matter.
Thank you. The issue here, I like the analogy you gave with the dancing masquerade. It seems that in our own situation here in Nigeria, that the dancing masquerade, that we abandoned our own dance and started admiring the other dancers in the field. And so we seem to have lost focus. We are totally dependent on foreigners for our drug. And as long as you are so dependent on outsiders, you can never be self-sufficient in drug development and drug production. So there has to be a drastic shift in having internal sources of medicine. And just like you said, I keep using that dancing masquerade analogy you gave. You can't watch the dancing masquerade outside without moving around and not dependent on one source of vision. What we have now is a situation where we are 100%, not 99%, 100% dependent on what other people do. Because even though so-called locally manufactured drugs, the actual pharmacon, the actual drug, is actually imported from outside. So in that sense, you're almost 100% dependent on foreign importation of drugs.
All right. Thank you very much, Professor Morris. Let's also get the establishing remarks by the Director General of NAFDAC, Professor Mojisola Adeyeye. Professor Adeyeye, well, again, we're all talking about national medicine security. We know that your agency has a lot of work to do in terms of having to monitor drug imports into the country, and even sometimes, substandard drugs that are produced in country. How medically secure or how medicine secure are we in Nigeria, and what is the challenge that lies ahead?
Thank you very much for inviting me. We are not medicine-wise secured at all. Just like Professor Iwu said, we are 100% dependent on foreigners to supply us what we need to make us healthy as a country. That is why we don't have security at all when it comes to medicine or access to medicines. However, if the regulatory agency is not strong, then even if we are making medicine locally, we're not going to be getting quality medicines. So to get quality medicines, the regulatory agency must be very strong. But NAFDAC is not just looking at quality. We are looking at trade also. We are looking at trade. If our medicines quality is not good, we cannot trade. Well, we can trade with other countries, but they will reject us. So NAFDAC has put in place so many systems. For example, we are just increasing our ceiling, which means a ceiling above which no importers can bring medicines into the country. We have increased that ceiling from 9 to 35 products, medicines, so that our own local manufacturers will have the drive to make medicines for us at home. However, when the only thing that the local manufacturer doesn't import is water, there's a problem. So we have to increase incentives for our local manufacturers. Nigeria is one of the worst in Africa in terms of incentives, because we have to import everything. So if the incentives like a tax rebate, rebate on packaging materials, rebate on equipment that we're using to manufacture, there will be a problem. So that is why it is important. It is a multi-sectoral approach that we have to give. Incentives is very important. NAFDAC has also done something very good, 5+5 policy, meaning if drugs are already being manufactured in the country by the bold, I will call them the bold local manufacturers who have to provide their light, their electricity, their water. That's why I call them bold. If those drugs are being produced in Nigeria, then we should not import them. So what we have done is you've been importing for years, and at the point of renewal, at the end of your 5 years, we give you a statement. Show us how you're going to migrate into local manufacturing. These products are already in Nigeria, because we're still going to be importing medicines, but not 70% importation that we are doing now. So we said, show us how you're going to migrate. And if that company doesn't show up at the end of the 4th year in that renewal cycle, we delist the company. We would delist the company so that our local manufacturers will not be facing undue competition of cheap or cheaper imported drugs. Over. Thank you.
Thank you, DG NAFDAC, for your opening comments on the status of medicine security in Nigeria. And let's return to the Honorable Minister of Health. Honorable Minister, once again, we do apologize. Technology fails when you least expect. But the good news is that we have rectified the audio. So give us your perspective. Are we truly, as the two guests say, is our medicine truly insecure, our national medicine?
Yes, what the head of NAFDAC spoke about, and to an extent Professor Iwu, is actually a description of where we are coming from. The idea that we could import everything we didn't need to make anything has reigned here in this country, and the same for drugs. People who just thought that you have to buy only imported drugs, and that's all that mattered. So focus on importing was very high, and it is this administration that is reorienting Nigerian thinking to focus on local and domestic production and manufacturing. And even the tax regimens on imports was quite unfair, because I know that during the first term of this government, we saw that the prices even on packaging and labeling and all those materials used for just to contain the drugs was very high. The duty was very high, so the government brought the duty down to make it easier for manufacturing companies here. And of course, the President's executive order on local content and business processes is all to help the pharmaceutical industry. The central bank has put down some 100 billion to support pharmaceutical industries, and they have joined in trying to access that facility to help to restructure themselves. Now, you spoke about the outbreak of coronavirus. It opened our eyes to realize that, well, at the end of the day, we are on our own, and we have to be able to take care of our own needs and demands. So there are elements going on now to ensure that we improve. The good manufacturing practices are going to be more watched over. I think 4 companies now have developed the WHO Good Manufacturing Practices. They have reached that status. So we are looking forward to that. Nigeria is also working on vaccine production, reviving the old vaccine facility we used to have in Lagos, in Yaba. We are working very hard with the private sector participation to reactivate routine vaccine production and even bid for production of COVID-19 vaccines.
I'm sorry to interject.
Yes.
With regards to the local vaccine production, at what stage are we, and for what treatment?
Well, the local vaccine production ended around 1992. When we had a factory in Yaba, we used to produce vaccins for yellow fever. And smallpox and things like that. But at that time it ended. The factory was supposed to be refurbished, but again, we found it easier to import because the money was there, and so that initiative went to sleep. It was reactivated again and pushed forward by this regime, the regime of President Buhari, to industrialize. And we have this partnership we reawakened with a private company, which owns 51%, the government owns 49%. First of all, to start manufacturing routine vaccines, the routine vaccines that we give to our children at certain intervals. And they have 15% of that market now assured. Now we are looking at joining the bid for production of COVID-19 vaccines, either by technology transfer or by contract manufacturing or whatever, to also be able to take care of the African region and Nigeria in particular.
What do you mean by 15% of the market assured? With regards to the
well, first, the 15% of what, well, first of all, let me say that the vaccine administration is done by NPHCDA, National Primary Healthcare Development Agency. And there's an agreement we have with Gavi to use certain vaccines in a routine way for children, what we call routine immunization. And that agreement was there, but in order to reactivate the agreement with that company, we took 15% of this requirement of NPHCDA to give to this company to provide. It's a good amount, and they themselves suggested that figure, and it's supposed to increase over time. So they are in the stage of preparing themselves now to manufacture that component of that quantum to serve our routine immunization. But we are challenging them again to join and see how they can extend their capacity to join in the production of COVID-19 vaccines. And we have been having meetings with support of eminent Nigerians from abroad who are backing this initiative and hoping that we can be able to put our foot in the door and join those who are manufacturing for the African region.
All right, thank you very much, Dr. Ehanire. Let's bring in Professor Martin Semeje. Professor Ebeje, of course, you listen to the other guests, say, look, there's some movement from where we were several years ago. But what is your reading of the steps that we are now taking towards recognizing that medicine security is imperative for us in this country?
Thank you again for inviting me. I have not seen any difference because for us in the academia, in the research sector, whatever you say, as long as research and development is not your priority, you are just talking. And the truth is that as a nation, we are good at talking. And we have been saying all of this for so long now. So it is time, and when I hear, in fact, by now, I expect that we should not be saying that COVID-19 has taught us lesson, because it dealt with us. And I believe that people who shouldn't have died because we did not have plan in place for what happened. No country expected COVID-19. There was no plan for COVID-19. But countries that were strong countries in terms of research and development had planned. They had prioritized research and development. They were already in place at some level such that if anything came, then there would be a fast and a way to get at it. That's why vaccines came out. That's why countries that did not, there are many countries that up to now have not been able to access vaccines, but they are not having high mortality because they also have local therapies that they use in their own countries and nations. And that's where R&D comes. That's where it's key. So we must, when we talk about local drug production, we can only connect it to medicine security when you undertake research and development in your country. It is not enough to pick up the manufacture of anything from any country. You come to your country, you open a company, you start making the medicine. We are already doing that. We call it secondary manufacturing. We get all our APIs and excipients. In fact, you heard
what does API mean? What
CNPC
or whatever?
Active pharmaceutical ingredient. Active pharmaceutical ingredient. But when you hear of paracetamol tablet, for example, the paracetamol is the active pharmaceutical ingredient. But that's not the only thing that makes that tablet. There are other things we add to it because nobody can consume paracetamol. We add other things. We call them excipients. Example is starch, cellulose. We put them for it to get to the form that you can now consume as a human being or animal. All of these are imported exactly the way NAFDAC DG said it. Which means if somebody decides to send us any of those things in the name of what we say they are, and they are not, and the person is targeting that they want to obliterate Nigeria from the surface of the earth, it's very easy. That's why we shout on medicine is a national security issue. And it is when you do your own research and develop your own product, your own natural resources, which we have in abundance, that is when you can be talking of medicine security. We should be discussing on what is our degree of medicine insecurity, not security.
So what is the degree of the insecurity in your view?
When you have already heard from Professor Ewu and DG NAFDAC, and I'm corroborating that we are insecure when it comes to medicine, then our degree of medicine insecurity is 100%.
Okay, let me also ask you. You are a fellow of the Pharmaceutical Society of Nigeria. What is the role of the PSN in ensuring that we have medicine security? What is your own role?
Okay, I don't speak for the Pharmaceutical Society of Nigeria because it has a president. Yes, yes. I needed to make this background. But as a fellow of the society and is a strong member of the society, let me tell you first of all that it's a non-governmental organization. It only has advisory role. It cannot enforce anything. Okay, so it can only tell government or the private sector, if you do this, this is the outcome. For example, PSN is responsible for the establishment of the idea, the initiative to establish the National Institute for Pharmaceutical Research and Development came from the Pharmaceutical Society of Nigeria. In fact, the seed money that was used to start that institution was given by the Pharmaceutical Society of Nigeria. That's the kind of role it plays. As in Umuahia some 4 or 5 years ago, the Pharmaceutical Society of Nigeria came up with a roadmap and said that, look, that in the next 10 years, Nigeria should not import starch. That is a shame that we are importing starch. Nigeria is the largest producer of cassava starch in the world. But we import starch to make our medicines. Okay, and if you speak with the industry, they give you millions of reasons why they cannot use our starch. If you talk to the private sector, they tell you the reasons why they cannot support research. Like you heard even in the part 1 that you played, you heard the president of PSN talking about no incentive for the private sector to do their work. You heard DG NIPRID talking about the private sector not interested. All of these are true. The blame is on all of us, from everybody, including ministers And all of us, everyone has blame. Because when you take the private sector, for example, you have to be ready for what we call national pride. We don't even have national pride. Sorry, yesterday I attended the Pakistan-Nigerian Friendship Day, and I heard a Pakistani saying that the best thing that ever happened to her in this world is that she's a Nigerian. A Pakistani. How many of us can say that about Nigeria? National pride is not there. If you look at these companies that manufacture many of these drugs in their countries, they are even ready to manufacture those drugs for their country at loss. Are we ready to do that? There's no pharmaceutical company in Nigeria that has a sound R&D unit. Because everybody is an importer, buying and selling. And for goodness sake, you don't need to go to school to do buying and selling.
But
just like as a...
You have first to be an apprentice anyway, and that's going to school.
Okay.
All right.
If you use it to justify all that is happening to us, you can go ahead and be justifying it. But I'm not playing.
No, Prof. I'm not kidding either. But the points you've made are noted. Let's pause you in the meantime. We will return. There are a number of critical issues you have raised. I want to bring in Professor Morris one more time. Professor Morris, well, I mean, there's a clear recognition that medicine security is part of national security. In the 80s and even early 90s, when Professor Olukoya Ransom-Kuti was Minister of Health and General Ibrahim Babangida was military president, there was something called the essential drug list that was released at the time. I mean, in the media, there was a lot of advocacy with regard to the essential drug list. Now, do we still have an essential drug list? And if we do, what does it mean in relation to our medicine security?
Thank you very much. I think the DG NAFDAC will be in a better position to talk about the essential drug list and the Honorable Minister. But the fact still remains, just like Professor Emeje just said, that unless you manufacture your own, you can never be self-sufficient in drug production and then the availability of drugs. But there's one other issue that then plays. What we are dealing here with is evidence-based medicine. You don't have to take paracetamol that you make and then throw it away and insist on taking Panadol, which is a proprietary product. What is happening in Nigeria is that we have totally abandoned the internal local research and development, and you can never go anywhere without that local input. The COVID-19 has taught us a very hard lesson, namely that you cannot depend on others to be able to treat yourself. Just like Prof said, a lot of people died needlessly. We could have been able to save them. But because there wasn't this nexus, nobody was able to link the dots. NAFDAC cannot do more than you give them money to do. NAFDAC cannot overnight create drugs that do not exist. Their job is just to be able to look at the evidence we bring before them and say whether they are right or wrong. So it is a national issue. And until we're able to link up the dots, we cannot go further. When earlier on in the COVID-19 pandemic, we did alert the world, and Nigerians particularly, that we should look inwards. Something here is happening here. The death rate that we have in Africa, particularly in Nigeria, is far, far short from what the world predicted. Have we interrogated that? Have we asked ourselves, is there an epigenetic factor working here? Why is it that Africa did not go down the bus as people predicted? Why is it that we seem to be doing better even with our low infrastructure? Why is it that our drugs seem to be working? We have more evidence than the vaccine that have been pushed down our throat right now. We have more evidence in our own locally developed products, but nobody gave us that kind of mileage because it is, as was mentioned earlier, it's more of a conceptual issue here that we don't seem to have confidence in ourselves. Since 1992 that we had a vaccine production program. How far has it gone? It has gone nowhere at all because we seem to be comfortable leaning on others. And in times like this, they will just withdraw their services and we are left on our own. Just like Prof said, how about if what they are sending to us is wrong? How about if it is some delayed action drug? How about if it's something that will kill us in 3 years? what is the evidence? We don't have the evidence. We just took them hook and sinker because the way says so, we have to take those vaccines. And that's not the way it is done. Even if those vaccines are based on the most rigorous science, we have to interrogate it in our own backyard. We have to pay our own scientists to look into them and say, yes, they're okay. Take a place like NAFDAC. One single area, they will need to have multiple scientists working with them. Do we have the funding in NAFDAC to be able, for them to be able to do their work? The answer is no. I'm not an insider, but from what I know about other agencies, if you take an issue like vaccine, for example, there are multiple scientists who are going to look into that particular terrain. Even when they don't have the inside competence, they normally contract these things out to some people outside. Have we given them funding for that? The answer is no. NIPRID, that is also there. Have we funded them enough for NIPRID to be able to interrogate the area they're supposed to interrogate? The answer is no. Almost all sectors, we just wake up and believe that miracles will happen. This is 21st century. Those things don't happen like that. The people work policies and then interrogate those policies. When the policies are okay, then they start implementing them. But we are not. Luckily for us, as I said, I believe it is some epigenetic factor that has made us sustain us so far. If not, we could have all been dead because the program we have, the policies we have, couldn't have sustained us at all. Thank you.
Okay. Thank you, Professor Maurice Uwu. My question, I'm going to throw my question open, but I know that the DG NAFDAC is also on standby. I would like for us to have a clearer understanding of really what we're talking about, medicine or pharmaceutical security. What does it entail? If it is what I'm thinking, which is having access and uninterrupted access to pharmaceutical products, for the well-being of every Nigerian, then who are the enablers? Pharmaceutical Society of Nigeria, we have over 100 of such companies in the country. So why are they not also activating the research and development that Professor Emeje is talking about? Maybe I should come back to you, Professor Emeje. Okay. Yes, because you have hit on R&D.
Yes.
As a critical aspect.
Yeah, because that's the key.
Yes. So why are your pharmaceutical the PSN generally, not activating that also? Why are you all throwing the ball, to the government?
Nobody is throwing the ball to the government. The ball is with the government. So nobody is throwing it to the government. The ball is with the government because government is governance. Government directs. It drives the vision. In your family, the leader of the family is the vision of the leader of the family that drives that family. That's what drives institutions. The vision of the leader is what drives nations. Government is supposed to have a vision, and it's that vision that every other person that is being led follows. Okay, so that's why we say government. But nobody is saying that government is the only. Remember, I said that we all have share in this blame. Once government has its vision and has laid out its roadmap, it is from there that every other person draws, either as individuals, the private sector, including companies that we are talking about, or even government agencies, institutions, or investors. Okay, so we do not have R&D agenda. What is the R&D agenda of Nigeria? Okay, now, the pharmaceutical companies that you are talking about, they are all in business. Remember, I've said that there's no national pride, okay, from that angle. They are all in business. So they will not, they are not trying to love you more than they love themselves because they are doing business, okay? But if there is a roadmap that they must follow, if there are models, if there are things that are put in place to be enforced, then they will. I'll give you an example.
But we do
Every pharmaceutical company.
We do have a roadmap. There is a 2005 drug policy, isn't it? Isn't that a roadmap?
Research and development roadmap.
Okay.
Okay, so if I'm going back to my thought, exactly the question you asked me on the role of pharmaceutical companies in R&D. The private sector, and including pharmaceutical industries, are supposed to play very key role in R&D.
Exactly.
And they support they have to support government. Okay, if you look at the vaccines we are talking about, the investees did the research and they were supported by the private company. And in the intellectual property sharing and all of that, they deal with it. Okay, so, but the private sector in Nigeria, the pharmaceutical companies in Nigeria will tell you that the government policy on import and export is in favor of import of finished products. As the national chairman of academic pharmacists, I and my team engaged the pharmaceutical industry because we gave ourselves 9 months to get a product of an indigenous product to the marketplace, and an owner of a big pharmaceutical industry in Nigeria told us, and he gave us a practical example. He said that a 100 ml bottle of ampicillin cloxacillin granules ready for reconstitution that is finished and is on the shelf in Nigeria as of 4 or 5 years ago was 180 naira. The patient or the customer with 180 naira will buy it. But he attempted to make it in Lagos. And by the time one bottle was ready on his shelf in Lagos, it has not gone to the pharmacy yet, which means the pharmacist, the community pharmacists have not put their markup. What he has spent industry cost was 450 naira. So he asked us, he said, okay, you are coming from the academia. You want us to do research. You want us to do local drug production. If you were the one, he asked us, he said, Prof, if you were the one that is the owner of this company, will you continue to manufacture like this when government, because of the tariff on this finished product, the one that is coming into Nigeria is cheaper?
Okay, well, fine. You've mentioned one issue now, which has to do with tariff. I believe perhaps you have a cluster of factors that account for this cost. And therefore, as economists will say, once you have economies of scale, you can then begin to have a lower cost of production. I don't know what factors there are. Professor Major, again, I just want to pause you in the meantime. We know that you have a number of points to make. I want to return to the Honorable Minister of Health. I asked Professor Morris Iwu that question, and then he said that either your good self or the DG NAFDAC will be in a position to speak to this. I was talking about the essential drug list. Under Professor Olukoya Ransom-Kuti as Minister of Health and General Babangida as military president, we heard a lot about the essential drug list. What is the nexus between the essential drug list and pharmaceutical security? And do we have an essential drug list now? Or what is it that drives our move towards enhancing Nigeria's national pharmaceutical security?
Well, the essential drug list is constantly being reviewed, constantly. And I think it was reviewed not very long ago. But it's a different package. The question of drug security is, and I'm pleased you said that, Professor Major said that the private sector supports the government. It's the other way around. It's the government that supports the private sector. Let me give you a few examples. BioNTech of Germany actually came up with this vaccine for COVID-19. And then they partnered with Pfizer to have the Pfizer-BioNTech. The government didn't have anything to do with it. It's a business arrangement. There's a producing manufacturing company. There's a R&D company who developed the product. And then the vaccine we're using now was developed in Oxford. And then again, partnering with AstraZeneca, which is a Swedish-British manufacturing company. The government doesn't get involved. We think that the government must get involved in everything, and that is not true. But to create the enabling environment for business to thrive and ease of doing business. This government has worked on ease of doing business more than any other government so far to make it possible. If you identify a bottleneck somewhere, bring it up, it will be looked at, and then there are many executive orders that have been issued, including local content. All of it is to encourage business here. Now, I agree with you that the pharmaceutical industries here are not very strong. They're not strong because, again, as you said, you also indicated that a lot of people have a crisis of confidence in what is produced here. If you have a product made in Nigeria, a product made in London, or made in UK, people will go for that. So it is that crisis of confidence that's also playing. When he said all of us are guilty, all of us are affected, well, he's right in a way. So we have to continue working on changing mindset, adjusting thinking, assuring consumers of the efficacy and quality of what we produce. And NAFDAC is doing a great job of doing exactly that, scrutinizing products and also marketing and working on good manufacturing practices, which 4 companies in Nigeria already have acquired WHO good manufacturing practices, and going to further to make your pharmaceutical companies reputable. Now, government also provided through the central bank 100 billion facility where pharmaceutical industries can take from or borrow, and many of them have actually done that. So that's all that government can do. Government itself doesn't go into production. You can't, I mean, we encourage R&D. I have been in conversation with Nigerians who have developed candidate vaccines for COVID-19. In Ede, I've been speaking with Professor Happy. He has a candidate vaccine. The question is how to find the money to develop it further, take it through. The question of taking it through the clinical trials. And we're looking for partners to do that because governments will focus on other things. And also another Nigerian, Simon Agwale, who also has the candidate vaccine, looking for ways to support that enterprise further, to support. But government will not capture that and take the lead and start to do it by itself. No, we make the environment for companies to take over, whether they're indigenous or even foreign.
You know, Honorable Minister, the temptation is strong. I mean, for all of us to focus on the vaccines, particularly while coronavirus is still lingering. But we do know that there are all kinds of life-threatening illnesses that require medication. And sometimes these medicines can be very expensive, whether it's for treatment of cancer, management of diabetes, management of high blood pressure. And the question then arises, because when you go to some of the pharmaceutical shops, I mean, you are told to say, look, you know, this one is generic, this one is from the original manufacturer, and so on and so forth. You go there today, the price is X naira, you are back there next week, the price is already X raised to power 2, and so on and so forth. I believe that these are some of the issues that Claire was asking about, to say, look, when you look at the totality of these things, then you get the impression that our pharmaceutical security remains in peril. What are we doing with regard to the production, whether by licensing or otherwise, of pharmaceutical products that can help in tackling life-threatening ailments?
Well, government can only open the door for investors and investment to go on. And also encourage R&D wherever it's taking place. I just told you that I'm in touch with those who are in the middle of R&D. But the pharmaceuticals themselves, they are burdened. I told you earlier that we were coming from a situation where we believe entirely on import. And even now, we still, to a great degree, have a preference for imports, which we need to fight. But what is coming on stream very soon is to encourage pharmaceutical industries with bulk purchase, locally manufactured, with the Basic Healthcare Provision Fund and the National Health Insurance Scheme, when it comes on stream, to be able to provide a much improved basic minimum package of service, which will include routine treatment for diabetes, as you mentioned just now, hypertension, malaria, and so on. And for these bulk purchases, patronize only domestic industries. So we hope that that will grow the domestic industry. Those are the indirect ways that government can help, and in its own way strengthen the domestic production. But this is not an age where government takes over and starts to produce things and manufacture. We have not had much success with that.
All right, let's bring in Dr. Adeyeye. I hope our connection it's right now. The DG NAFDAC, again, preference for foreign imports. I mean, import pharmaceutical products, imported pharmaceutical products. All right, I'm told, okay, she's back, all right. So, DG NAFDAC, I'd like for us to talk more on the preference for imported pharmaceutical products. The minister just referenced it a while ago when he was speaking. And I'm wondering why we will have, for instance, Panadol, you know, produced by Emzor, and we all know Emzor is, you know, a Nigerian pharmaceutical company. And then you have so many imported competing, you know, products similar to what Emzor is doing in the market. They have been advertised on radio, on television, everywhere. Why do we have that?
Oh, that is a $1 million question. And it is to our shame as a country. And all of us have a part to play in taking this blame. It's a summation of the disease of over. We are using Panadol and the local manufacturer as an example. That local manufacturer has to import everything to make that Panadol, including the plastic that is blister pack that is going to, you know, contain the tablets. Imported products are mainly from China and India. About 70% are from China and India. And there are different scenarios. There is a book called Bottle of Lies. It was written by a journalist from the developed country, but most of the facts are from an Indian scientist. When you have an active pharmaceutical ingredient in a tablet like Panadol, you know, which is paracetamol, you have other products, other non-active, called excipients. Our people will go to India and say, okay, I want to buy, they will offer our manufacturer, a typical manufacturer, or importer rather, I'm going to give you different grades of the active pharmaceutical ingredient. One is $3 per kilo. Another one is $10 per kilo. Another is $25 per kilo. I shouldn't say naturally. Many times, our importer will take the cheapest active ingredient to make that Panadol. And so you can see where the price difference is going to come from. And then in that book, there's what is called the second shift. Second shift. 10 importers will have one manufacturer. We are fighting that as we speak in NAFDAC. I'm trying to see what policy we're going to develop around it. 10 manufacturers of Panadol. We go to one company in India to manufacture Panadol for A, B, C, D, E company. And this second shift, according to that book, and it's a fact, that the second shift will be cheaper than the first shift, meaning manufacturer A got made the highest or paid the highest amount to this manufacturer, to this company. And then manufacturer D paid less. Why? Because sometimes the active pharmaceutical ingredients in the second shift is less than the first shift. And they bring it to our country 50% less, 30% less. And if it is antibiotics, you don't have to kill somebody. You don't have to pull a knife on the throat of somebody. If it is antibiotic, you are killing them slowly because of antimicrobial resistance. What has NAFDAC done? I went with my team to India and China 2 years ago, almost 2 years ago, and I gave them the Riot Act. You want us to have a relationship? You better make sure that products that are coming to our country have quality. We changed our CRIA rules or mechanism since March 2020, when we signed all the agreements with the laboratories. We actually went to so many laboratories, 19 across India and China, and we told them, these are the standards, these are the equipment that we want to see in your lab. Now we have stopped about 70 products from coming in. Products that don't have active pharmaceutical ingredients, that have less pharmaceutical ingredients, tablets that will not dissolve, because our laboratories over there that we have signed agreement with, that we have read Riot Act to, will send us results before they issue CRIA certificate. So that is why it is cheaper, but things are changing. If a company is playing or trying to make bad quality products in Nigeria, if it's in Ota, it's a matter of 1 hour we drive there. If it is East or Kano or wherever, we fly there. We have shut down the lines of some companies in Nigeria because we found their products to have less active ingredients. We shut them down for months, and using our GMP, good manufacturing practice mechanism, and asked them to give us root cause analysis. And we also find them. So when you shut a line down for about a month, it hits the pocket. It hits the pocket hard, because it is not just having access to medicine that makes us secure, it's having access to quality medicine that makes us secure. So as we are tightening the regulations for import, we're also tightening the regulations for locally manufactured products, because that is the only way. That is the only way we can have medicine security and we can trade. NAFDAC just instituted an Office of Trade and International Relations, because, again, I'm mentioning it, African Free Trade Agreement. We will be shocked how many products will be coming into our country. And if we cannot sell to other countries as the biggest in the continent, we're going to be in trouble in terms of GDP. So the reason for the import, people going to import, is because, first of all, they don't have to go through infrastructure somersaults that local manufacturers go through. Secondly, they make the medicines are there, the active pharmaceutical ingredients are there cheaper, the non-active pharmaceutical ingredients are there cheaper, the capsules are there cheaper, everything there is cheaper, even if it is good quality active pharmaceutical ingredients or excipients. Unlike now shipping it into the country. And when you get into the country, sometimes it can stay for months at customs. It can stay for, so this is a multi-sectoral issue that we all have to wake up to, because nobody can say, oh, I will never be sick. And if we say you will never be sick, you better watch out. So it is from the customs to NAFDAC, to the storage, to good distributor, to the distributors, to the pharmacies. But like we are saying, the government also has to. We have to know that this local manufacturing that we are talking about doesn't just look at imports. Research and development. I was a professor. I'm still a professor, but I was actively a professor for 30 years. To do a research that can be published, it takes at least 3 years. That is if you have the design very well. Our government has to put money into R&D. I was on the National Institute of Health panel since 2000 up to when I came to the country. We review, this is government agency. We review proposals in millions of dollars that they submit. The government funds it. Most of the patents that America has now came from the university. The government was funding actively R&D. And it is not just, funding to give a little money. The infrastructure of the university itself is conducive enough for research and development. For example, the government just gave CBN a go-ahead to do the intervention scheme that I'm chairing. That is a sign, or a step in the right direction. But we can do more. We can do more. Research costs a lot. Research costs a lot. And if we invest in it, 5 years, 10 years, we're going to reap it. It's an enterprise. Our students have to be trained from the university to know how to ask questions, because that's research. What if? What if? What if? If the environment is not even conducive for students to think outside the box, or to the professor himself to think outside the box, then we cannot even have productive R&D. The students that we're getting out now, the graduates, are not prepared even to fill the vacuum in the manufacturing sector. So these are all multi-sectoral things that we have to. But the government, like the Professor Emeje said, has to put money into research, and also the government to patronize local manufacturers. Over. Thank you.
All right. Thank you very much, DG NAFDAC. I think that you are all virtually on the same page with regard to what needs to be done to enhance Nigeria's pharmaceutical security. But just to clear, while the DG NAFDAC was talking about funding R&D, say in the universities, I was just wondering, there is TED Fund. And the purpose of TED Fund, of course, is to fund tertiary education. Mostly what we hear about are physical structures. They are built new lecture theaters and so on and so forth. They've also been engaged, of course, in the sponsorship of some academics, either to conferences or otherwise. But it may very well be, because TED Fund, I believe, has quite a huge reserve. 2% of companies' tax goes to TED Fund. To say, look, okay, can we then devote a certain percentage of that 2% to pharmaceutical research, considering the necessity of pharmaceutical security? All right, so these are issues that we'll continue to take a look at. We'll go on a short break now. When we return, we'll get back to our guests.
All right, you're welcome back to Good Morning Nigeria. Just to remind you that you can also be part of our conversation by using our Facebook address at GMN, NTA GMN. Now, let me take my question to Professor Maurice Iwu, who is joining us via Zoom from Owerri. Prof, the point has been made by almost everybody of the need for a strong R&D. And just a while ago, Kingsley also muted the idea of, some percentage that could be devoted from the budgetary line of TED Fund and devoted for pharmaceutical research. But be that as it may, you are a professor and you have, come out with some locally researched brands, and you have been pushing for mainstreaming your brand for acceptance. Can you share with us some of the issues that have been limiting, your brand from entering or from being accepted or integrated into orthodox medicine?
Thank you very much. First of all, let me correct one impression that the Honorable Minister seemed to have gotten, namely that government in a third world country has to take oversight, center stage, almost 90% of the funding of research and development. Then when you move from developing to develop, that is when what he's talking about in terms of Pfizer then takes place. You can also understand that when it comes to Oxford, AstraZeneca, Oxford is a university because it is Britain. They are not really the stage of the US. So they have to have a binary fusion between the two. But instead of the lamentation, I think something positive is happening. Based on our own experience, when we started with the COVID-19 therapy, we approached NAFDAC. It took time for NAFDAC to be able to respond. But as soon as NAFDAC listed the product for clinical trials, a whole lot of things started happening. The DG of Raw Materials Council gave out some farmers some help to be able to supply us with the raw material that we needed. Immediately that happened, some farmers, 118 farmers, formed themselves into a platform of growing those crops. You could see how it is flowing back into the economy. The issue here is that if given the support, the government have to play a central role. Let me also explain what is happening. The Madam DG of NAFDAC will also bear me out in this. In the US, it looks as if it is private sector. No, behind the scene, there is serious government intervention. You don't see it. It's the secret hand of the US government that is playing out in the COVID-19 therapy. And also, if in our own case, we are not asking for a handout, not at all. Because as soon as we started having a product, a major pharmaceutical company called Nimet now distributes the IHP detox tea, which is mainstreaming it. And also the other product that we are working on with Niprate, for example, the artemisinin. If, for example, government has sat us together and said, look, we want this thing happen, customs, any request for any drug manufacturing, any that you should have, give it SOS. Then we are working the same thing. When we're talking about government intervention, it's not necessarily cash. It's the enabling environment. You'll be able to talk to those who are concerned, talk to people in the NTA, that if anything coming about drug manufacturing, drug supply, give it a special window so it doesn't stay at the wall for so long. So that's what happens. So in the type of TED fund, again, the government policy, if the government tells people in the TED fund sector that you must put a certain percentage for non-facility support, that is, they'll be able to use it to buy chemicals and so on. They will do that because it is a government policy. So back to what is happening, it is not all us lamenting and so on. Things are happening and happening well. But the issue there, for example, even if you make the best vaccine, let me tell you how it is a closed shop. You will not sell it in Nigeria because we already have supply agreement with Gavi and other agencies. So you have to really pass through a hurdle. Again, without government support, you'll be wasting your time. Everything revolves around government in a third world setting. We are not the first. Then the two countries that we go to buy our medicines, India and China, one thing they have in common, that they have a dual system, a parallel system. Their traditional medical systems are strong, freeing a lot of their own resources to be used in the few manufacturing industries they have. Some diseases, let us face it, diabetes, high blood pressure, they have no Western treatment at all. All they do is maintenance. They give you treatment drugs that you'll be taking all the days of your life. They don't cure you. And so we should be able to allow our own local traditional system, if they claim those things. Evidence-based medicine means that there has to be a conscientious effort to marshal out the evidence that you have. As I mentioned earlier, we took the vaccine to grow the whole world, but there is little evidence to prove that, to show that it works. Little evidence. And yet we took it in terms of believing them that, yes, those vaccines are good. The evidence I'm talking about, because there are vaccines, there's a time factor. It's just like pregnancy. It has to last 9 months. We don't have that time yet, where we have been able to look at the evidence that they gave us. We're only believing them. But if you also follow what happened here, remember the chloroquine data, that it was later on found that the whole thing was cooked up by the West, and some kind of this fallout. We're all almost going to drink that drug globally, until it was found that the data that they supplied the world were all false. So what I'm saying, in effect, that you cannot rely on another person for your own medicine security. You have to do it yourself. Even if it's the best scientist in the world, you have to interrogate whatever they give you to make sure that they are giving you the right thing. And that is the only way government must be the person playing the center. You have to fund NAFDAC. I like NAFDAC being conservative. We put products on the pipeline. It takes months. I don't blame NAFDAC, because you have to have the wherewithal to have expertise, to have be able to contract. You have to fund Niprate. Most important, you have to fund the universities. None of the pharmaceutical faculties have an industrial park. What stops them from having one? In which case they can make something like paracetamol and be able to make small synthesis for our own particular need. not for export for now, but there's no such thing happening. The other issue that there is a paradox of the excluded middle here. The pharmaceutical companies don't make drugs. Know that what they make is the pharmaceutical products, the finished product. The actual making of this are heavy chemical industry that manufacture those active pharmaceutical ingredients. We don't have any. We also need industry to be able to make even the excipients. We don't have any. So at the end of the day, it still falls back to government. Governments have to, that's why I'm really making this point, that the Honorable Minister for Health must really assume that there has to be an 80-20% spread. Namely, 80% of their budget has to be going to outside. They only retain 20%. Even the NIMA in Lagos, they have to be funded enough to give grants. That's how it's done outside. The whole thing to me is so laughable. We are not yet serious and ready. Now, the COVID-19 has taught us a very bitter lesson. You cannot depend on other people's masquerade to be able to enjoy yourself. If you want to be able to entertain the same masquerade issue you have, you don't look at it from one side, but you have to also have your own masquerade. And in this particular case, we have totally dismantled our own masquerade, and they are dying, and we are not doing anything about them. Thank you.
All right, Professor Morris, thank you very much there for your points. You touched on one issue that I would like Professor Emeje to also explain. You see, there's been copious reference to active pharmaceutical ingredients. Now, who produces the active pharmaceutical ingredients? Earlier you talked about industrial starch, which is from cassava. We also hear that yam can be a source of a number of pharmaceutical derivatives. Although at some point it was suggested that we should be exporting yams rather than getting the value from that yam. Who should lead? Yeah, who should? I'm not saying we're part of it. Who should lead the production of active pharmaceutical ingredients? That's one. And then two, I think we should also be wary of maybe having a blanket condemnation of our pharmaceutical security. I know that there is a syringe factory somewhere in Akwa Ibom that is producing. Syringes are important. I don't know what else is being produced, whether we produce bandage, whether we produce plaster, whether we produce gloves, and a few other things that you need to find, you know, in a hospital environment. But take my question, Professor Emeje.
Thank you very much, and I'm glad at the way it is all being encapsulated, and you can see that we are beginning to get to the same table in terms of agreeing on what should be done. Chemical companies make chemicals. So there are companies that specialize in the synthesis or industrial manufacture of active pharmaceutical ingredients. There are also companies that want to specialize in the manufacture of excipients like starch, cellulose, and all of that. There are also companies that will be specialized in making syringes and needles. In fact, as a pharmacy student at the Ahmadu Bello University Zaria, we went to the pharmaceutical industry in Zaria that was making syringes, Zarinject. In fact, it was one of the best syringe and needle making company in Nigeria for the entire West Africa. The current chairman of the Pharmacists Council of Nigeria, Professor A.T. Mora, was the managing director of that company when we were students in Zaria. Today, they don't make any syringe. So that's
what are they doing now?
So I don't know.
Pure water or something?
I don't know what they are making now, Kingsley. But you see, so when we say government, these are all the reasons why we say government. I believe that the Honorable Minister will agree now that they produce the vision, and everybody is supposed to key onto that. So he's going to start to speak to all the people that are sitting there, saying that government is supposed to provide the necessary leadership for us to support. Because as long as we don't get those little things together, we will all be moving in different directions. Because if our minister, that we believe that our minister, we are to support the vision, the roadmap that is being led. If he says, no, you are supposed to do something, then we support you. Then we will be moving in different directions. When we agree that, okay, you provide, we support, or you no, it's you that should provide, we will support, we will agree. Then, we will, as a nation, we will, all of us will move in one direction because we are a family. And so if we go back to those companies, a pharmaceutical company can decide to specialize. It's based on your expertise and your own infrastructure. You can decide that, okay, I'm going to be involved only in making of secondary active ingredients. You see, because active ingredients are also of different grades. There are those ones that are chemicals that are not used for consumption, that we call are chemicals, and they go to the laboratories where we use for research. Then when you are now going to the one that will be consumed by man or animals, you don't use the same grade. The purity level is not the same. So
yes, we have to stop. We have to stop because we are going to do deep into the chemical aspect of the whole.
No, Claire is very important because the more he spoke, the more I just asked myself. I'm sorry, to say, look, you have some quoted companies on the stock exchange dealing with chemicals and so on and so forth.
Yes.
How well involved they are. I mean, if you go to the Ikeja industrial area in Lagos, I mean, we'll see some of these ones, but apparently they are not adequate. And therefore, for policy consideration, it is not, it appears from what has been said, not sufficient to say, okay, we have given the pharmaceutical industry 100 billion naira to pursue their business. Now, the supporting industry, such as the chemical industry, those who may produce, who are probably enabled to produce active pharmaceutical ingredients, ought also to be brought along.
Yes,
that's the point.
Yes, that's the the point, and that's why, for example, there is starch for food. But not pharmaceutical grade, because the simple step that is responsible to make it to the pharmaceutical grade, the industry will tell you the cost implication. And vis-a-vis the policy of government on importation gets that cheaper than the one they are making. So government must say, look, we can do this. Leave your own. We want to do our own.
Wow. So it must not just be starch and banga alone.
Yes.
With dry fish.
Yes. We are running out of time. Let's bring in the Honourable Minister for his closing remarks, and that will be on what you think should be the immediate enablers to offset, our dependence on pharmaceutical, products, and then a little bit more on the 100, the CBN's intervention fund that you have talked about.
Yes, well, it's there, and that's why if you have a free market system, you have entrepreneurs. Somebody will come up and say, "We want to work on," and I've seen one or two people come to say, "We want to work on production of active pharmaceutical ingredients." And then all you have to do is back that person. So because government has a huge array of things to look after, huge. Pharmaceutical, if I the medical side, health side, just one. Very important, the most important, but is one of a large number of things that they have to look into. So we need the active participation, the active encouragement of those who are in that area, either in the commercial area, in the R&D area, in the industrial scientific area.
You have 30
all
seconds.
of them have to come up.
30 seconds.
Yes, all of them have to come up with the support to say, this is what we want, and we back it. As we are backing now those who are looking for clinical trials for the vaccines that they have produced.
All right.
Okay, sorry. Honourable Minister, thank you very much. I'm going to try and get some starch and banga this weekend. I don't know where to get it in Abuja, but
I think the Magic can supply that.
Maybe Professor Magic can supply that.
I'm sure you see the smile on Kingsley's face when he talks about food.
In fact,
All right, let me appreciate the Honourable Minister for Health, Dr. Osage Ehanire. Thank you very much, sir, for joining us. Professor Martins Emeje, Fellow of the Pharmaceutical Society of Nigeria and immediate past Chairman of the Academic Pharmacists in Nigeria. Thank you. Let me also appreciate Professor Maurice Iwu, Presidential Bioresources Development Group. Thank you very much, joining us via Zoom from Owerri. And DG NAFDAC, Professor Mojusola Adeyeye. We appreciate both of you for joining us for this conversation. And Kingsley,
all right, so that's it on Good Morning Nigeria for today and indeed for the week. We are back on Monday, same time, 7 in the morning. Until then, do enjoy yourself. As I've promised, I'm going to try and look for a joint to get banga and starch.
Well, for me,
I'm Kingsley Osadola.
For me, I'll go and do for Amala and Begiri. I am Claire Dilabu Abdulrazak. You have a great day, and don't also forget to join in our fight against rape and rapists. From all of us here, bye-bye.
Thank you for watching. For regular updates in health sector and pharma research and development, click on the subscribe button right now. Remember to like and share as well.